The federal health minister says the crisis in healthcare staffing must be addressed.
Healthcare workers are tired, exhausted, many of them are sick, many of them have left. We're all looking forward to a final agreement at some point, but we are all very mindful that there is still lots of work to do before we get there.
On that front, in the effort to find solutions, Nova Scotia's Premier held a summit today, gathering with leaders across the healthcare sector in his province, Nova Scotia. They met following the deaths of 2 women who died after waiting hours for emergency care. Premier Tim Houston joins me now from Halifax. Premier, thank you very much for speaking with us. You had a very big meeting today. I'm curious as to whether any tangible changes are coming out of this meeting that people in your province can expect to see.
Yeah, thanks so much. Thanks for having me today. I really appreciate it. So yeah, I just left a meeting with. We had all of our colleges, our universities, our associations, really the health leadership across the province, everyone that can have an influence on healthcare. We had them all together in the same room today. It was a great meeting, but it was a frank discussion about what's possible and what's necessary to make sure Nova Scotians can get the care that they need. So there's a series of short-term takeaways, some medium-term, some long-term, as always. But really the message that I wanted to kind of share with that leadership team today was go like hell. Go as fast as you can to get this fixed. If there's any hurdles in your way, let me know. If it requires legislation, let me know. We'll do what we can as a government. But really, I just wanted them to know that they have a premier, they have a government that is supportive of what they're doing, and we will help them. We will work with them, but there's a role for everyone. That was really the gist of the meeting today, and it was a coalition of the willing. I mean, there was people were there. They want to get things done, so we'll see some positive progress from that.
You say you want to go like hell, but what exactly are you going to do? Is there anything specific? I recognize this is not an easy fix, but is there anything specific that came out of this that you can go like hell with?
Yeah, I think there is for sure. I mean, look, there's a lot of discussion around scope of practice, making sure pharmacists can do everything they're trained to do, physios, nurses, like those types of discussions, and really just making sure that everyone was in the same room. So there can't be any turf wars. This is going to take many hands to fix this. So I wanted everyone to be at the same table where they could hear what their colleagues from another discipline and another allied healthcare professional thinks they can do, so we can have that frank discussion. So a lot of discussion about that, and certainly some immediate things we can do on the patient experience. If you think about our emergency rooms, some of the tragedy that we've had there, how can we better communicate with patients? How can we better monitor patients? So lots of discussion around that. But look, this is a big issue. It's been building for decades, really. There is no real quick fix for sure, but there are a number of positive steps forward that we can take, and we need to take them together in unison. So that was the discussion today, and Nova Scotians should know, and as like all Canadians, there's a sense of urgency here. I'm singularly focused on this. I'm totally focused. My resolve is as strong as it's ever been, and the people who are running the healthcare system that were there with me today, same for them. They want to do better for Nova Scotians.
Do you consider the nursing shortage in Nova Scotia in hospitals to be a crisis?
I consider what's happening in our healthcare system in general to be a crisis. I mean, I've used that word before. So the human resources, the need for nurses, the need for doctors. We heard today, looking at the intake into some of the pharmacy programs is not as high as it has been in the past. So down the road, how many are we going to graduate enough pharmacists? So the human resource discussion is a significant discussion for sure. It's front and center. There are other things that are part of the discussion as well. How can we better use technology to support those working in healthcare? Those are all part of the discussion, and we're certainly not leaving any stone unturned. And when you get that many people, smart people, people in a position of leadership that have the opportunity to make a difference, when you get them all around the table, they'll tell you what they think is possible. They'll also tell you some of the things that they just don't think would work, and we need to know that too.
When it comes to the vacancy rates in some of your hospitals, there are some alarming numbers that our colleagues at CBC in Nova Scotia have uncovered about that 80% vacancy rate in one certain unit alone. What are you going to do to get more staff into your hospitals?
Well, look, the question of recruitment is a topical one for sure. Recruitment starts with retention, so it starts with respecting those workers that are there, and that respect, goes in just making sure they have a work environment where they feel supported, where they can do the things that they need to, that they're trained to do. So that's part of it. Compensation's part of it for sure. So we have to think about retention. It's just treating our healthcare workers with kindness, both as an employer, but as a citizen as well. When we see these healthcare workers, it's easy to get frustrated when you've been waiting. We can't really take that out on our healthcare workers. Certainly no tolerance for violence. So these things are all really important. And then when we come to recruitment, so we'll look at all kinds of things. Is the way we're training grads, is it practical? Is it in a condensed enough period? Can we do it quicker? Can we recruit across the country, across the continent, or internationally? So there's a lot of focus right now. We have a great country, and certainly in Nova Scotia is an incredible province. Great quality of life. People want to live here. So those people that are practicing healthcare in another part of the world who are qualified, we need them to know about Nova Scotia so we can get them there. So there's lots of retention, recruitment. These are the topic of we can talk for a long time on those, but I think there's lots we can do. We need to do them all.
Before I move on to one other subject, you mentioned violence. Do you have any specific examples of violence occurring in healthcare settings because people are frustrated from wait times? Am I understanding correctly what you sort of said there? Is that what you meant?
I think it's just something we need to be conscious of because it speaks to the question of retention. It speaks
but
to
is it happening?
People,
is it happening
how people are respected. So,
but is it happening in Nova Scotia?
Anecdotally, we hear from. Yeah, well, I'm sure it is. If I talk to nurses and people who work on the front lines, they would have a story to tell about their own experiences or a colleague. So I want to make sure that we're being mindful of that and we're responding appropriately. I don't have anything front and center if that's what you're asking, but I do hear anecdotally about people yelling at a nurse across the parking lot or in the room. And I just want to say we're not going to zero tolerance for that. We're going to nip that in the bud. It all speaks to the broader question. Everyone's frustrated. Everyone's a little nervous with the status of healthcare. I've said before that nationally our Medicare system, it's on the ropes. It really is. I mean, every community, every province is, this is a headline news story because it's in trouble. We can fix it. I'm a believer in the public system. We can fix it, but we need to feel that sense of urgency and we need to respect those that are already working in the system and treat them with kindness.
Ontario Premier Doug Ford is expanding the number of procedures that happen at for-profit clinics. Is that something your province is considering?
Yeah, considering and doing. I think it was in the summer we announced a very similar thing with eye surgeries. Working with private clinics, and we'll continue to expand that as well for sure. Because, look, Nova Scotians, Canadians that are waiting for a surgery, they just want that surgery, and will still be the single payer. The province will still pay for it. It'll still be publicly funded, but it could be a question of instead of going to one of our regional hospitals, you go to a clinic somewhere, and we'll offer that choice to Nova Scotians. And I believe that if we offer the opportunity to get their procedure quicker, to make their life more comfortable quicker, that they will take that up. And we are doing it already with eye surgeries, but I've instructed the team to look for other opportunities to expand that for sure. It is part of the solution for sure.
Today, Prime Minister Justin Trudeau was asked about ongoing talks between the province and the federal government, and he expressed confidence that there will be some sort of agreement in the near future. What is your perspective on where those talks sit right now when it comes to funding from the federal government?
Well, I think, look, they've been stalled for a long time. And as a group of premiers, we've been pretty focused on that partnership with Ottawa. We need that partnership. We need it in money. They need to fund an appropriate share of healthcare. I don't think they are at the moment, but I hope there's a willingness to increase their funding. There are other aspects to it too. I mentioned immigration, working with us on immigration so healthcare workers can move here. Support around technologies. There are lots of things that we could be talking about. This is why I've just been urging the Prime Minister to sit down with the premiers and have that discussion, much like I did today with the leadership team here. Have the discussion with the premiers, look each other in the eye, say what's possible, but certainly on the funding, the federal government has an opportunity to step up and fund more, be more of a funding partner with the provinces, and I think it's necessary.
I have two last questions for you. The first has to do with Alison Holtoff. the 37-year-old woman who died in an ER just a short time ago. One thing that her husband said when he spoke to reporters that really stands out with Canadians, I know that when I heard it, it sort of stood out as something that we need an answer on. He said that as of that time when he spoke publicly, there had been no information shared with him about the autopsy or what actually led to his wife's death. I'm not expecting you to get into her personal, divulge her personal information in this program, but what I do want to know, has her husband been given any sort of information, any sort of clarity as to what actually happened there?
I think there's been discussions with the family is what I would say, but what the important thing to remember is when we have an unexpected outcome, a negative interaction with the healthcare system, it's automatic that it triggers a review. So that review process is in place. There will be interviews with staff, there will be interviews with everyone, with family. Everyone will have an opportunity. That'll be a review that takes place. And then the findings of that review will be shared with the family for sure. And people have asked me, well, will you make the whole thing public? You know, we'll make as much as we can, being mindful of people's privacy and, you know, all those types of things, right? So I believe there's been discussions, but the review, I think, hopefully, you know, will be fulsome enough that it provides some clarity and provides some information. It's an incredibly sad tragedy for sure. I mean, it's really certainly impacted the family and rocked the community, rocked us as Nova Scotians, and as you said, nationally as well. It's had a huge impact, including on those working in the emergency room at that time as well. So we want the answers. We want to do better where we can. So there'll be, you know, that process will take place, and then information will be shared as much as it can be.
When you were sworn in back in 2019, one of the first things you did as Premier was to fire the CEO of the Nova Scotia Health Authority, a doctor, Dr. Brennan Carr. You replaced him with Karen Oldfield, someone with zero healthcare experience. She instead served as the CEO of the Halifax Port Authority, and previous to that had worked for former Progressive Conservative Premier John Hamm. Do you stand by that decision, getting rid of a doctor to lead the Nova Scotia Health Authority and replacing him with someone with zero healthcare experience?
What I did was I replaced the board too. So we wanted to put people in place that were completely focused on healthcare and weren't bringing any preconceived
there was a doctor
notions.
there, and you put someone who has no healthcare experience there, and we haven't seen outcomes go the way you hope in Nova Scotia.
Well, listen, the reason that the healthcare system was the way it was, the reason I won an election saying I was going to fix the healthcare system is because people weren't happy with the healthcare system. So to imply that staying more of the same.
Well, no, I'm just asking someone who has healthcare experience with someone who doesn't.
No, somebody has experience with process and fixing things and listening and being open to receptive from ideas and doesn't have, you know, is not encumbered by preconceived biases about the system. I wanted to put the best person in the place. I did put the best person in place, and I would do that 1,000 times again, because what we need to do is we need to move forward. So look, I was very clear with Nova Scotians. Fixing the healthcare system would take a lot of money, and look, the budget is there. Look at our budget. We're focused. We're spending on healthcare. I was very clear that it would take time. But you know, and it is taking time, that's for sure. But and I was also clear that it would probably get a little bit worse before it got better. That's the nature of a system that is moving in that direction. It was moving in a very, very negative direction. So we're making a lot of positive changes that will kind of slow that down, reversing course to where we have a system that we can all be proud of. It's going to take time, but I assure you, the leadership team that is focused on fixing healthcare, their resolve is strong as ever, and I have complete confidence in that team because they're listening to 9,000 healthcare professionals every day, not just one at the top. We're listening to those working the front lines of healthcare every single day, taking their suggestions and moving forward. So I have complete faith in the team. We know there's a lot of work to be done. Nova Scotians know that. Canadians know that there's a lot of work to be done. But people are reasonable people. And I think they're willing to know that it takes time.
Premier Tim Houston, thank you for your time today.
Thanks for having me.